Do you frequently feel like your nose won't stop running even when you're not sick? Or maybe your sinuses hurt so much that even bending over makes it worse. What if your eyes feel constantly dry and swollen? These might seem like common cold symptoms, but what if it's something deeper? Meet granulomatosis with polyangiitis GPA, formerly known as Wegener's disease. It's a rare condition where your body's immune system, meant to protect you mistakenly, attacks small blood vessels, especially in your nose, lungs, and kidneys. It's like your immune system gets confused and starts damaging your own body. Sounds scary, right? But here's the good part. If caught early, it can be controlled. So, what causes your immune system to go rogue like this? That's the big mystery. Scientists don't know the exact cause, but imagine your immune system like a security guard. Normally, it fights off bad guys like viruses. But in GPA, something, maybe a past infection like a nose bacteria, tricks the guard into thinking your own body is dangerous. So it starts attacking your blood vessels, causing inflammation and clumps of immune cells called granulomas. It's not contagious, you can't catch it from someone else, and it's not inherited, though having a family history of autoimmune issues might raise your risk. Think of it like a software bug in your body's defense system. Let's play a quick game. Raise your hand if you've had a nosebleed for no reason, or if you felt short of breath while climbing stairs, even though you're fit. What about persistent ear pain or hearing issues? These could be signs. GPA often starts quietly. You might think you have chronic sinusitis, stuffed nose, nosebleeds, even crusting inside the nose, like coffee grounds in your nostril. Then it spreads, coughing up blood, chest pain, or kidney problems, like finding blood or foam in your urine. Some people get red, painful eyes. Others feel tired all the time. It's like your body is sending multiple alarm signals, but they feel like separate problems. That's why GPA is tricky. It masks itself as other illnesses. How do doctors find out if it's GPA? Let's pretend you're a detective. They look at clues, blood tests to check for ANCA antibodies. These are like wanted posters the immune system made against itself. Then imaging, like a chest X-ray or CT scan, to see if there are nodules or damage in your lungs. Sometimes they might take a small tissue sample, a biopsy from your nose, lung, or kidney. That's the gold standard, like finding fingerprints at a crime scene. Once confirmed, treatment starts fast. It usually includes steroids, like prednisone, to calm the immune system, plus stronger drugs like rituximab or cyclophosphamide. Think of them as reset buttons for your overactive immunity. After control, they switch to maintenance drugs like methotrexate to prevent relapse. Yes, there are side effects, but with regular checkups, most people get back to normal life. Can we prevent GPA? Right now, no vaccine or pill can stop it before it starts. But here's what you can do. If you keep getting strange sinus infections, nosebleeds, or unexplained fatigue, don't brush it off. Talk to your doctor. Early action can prevent kidney or lung damage. Think of it like car maintenance. If the check engine light comes on, you don't wait for the car to break down. Same with your body. Staying aware, getting regular checkups, and knowing your body's normal versus abnormal are your best tools. No magic shield, but knowledge is your armor. Exciting new scientists are getting smarter about GPA. New research is focusing on more targeted treatments, drugs that stop only the harmful immune cells, not the whole system. Imagine a sniper instead of a bomb. For example, newer biologic drugs like avocapen are being tested to replace high-dose steroids, which cause weight gain, bone loss, and mood swings. That means fewer side effects and better quality of life. Also, studies are tracking NCA levels over time to predict flares before symptoms return, like a weather forecast for your immune system. Clinical trials are ongoing, and scientists are digging into genetics and environmental triggers. So while there's no cure, yet the future is looking brighter and more personalized.